Respected audience, Assalamu alaikum. I am Professor Shamsud, Professor of Pathology. I welcome all in today's 5th lecture on systemic pathology. Today, day 1 of diseases of small intestine. Day 1 of diseases of small intestine. Today's topic is Crohn's disease. Day 1 of diseases of small intestine. Today's topic is Crohn's disease. Dear audience, now come to what is Crohn's disease. It is one of the inflammatory bowel disease and idiopathic chronic ulcer-constrictive inflammatory bowel disease characterized by transmural non-caseating granulomatous inflammation. Non-caseating granulomatous inflammation. So, Crohn's disease is an idiopathic disease. It is a chronic disease where there is ulceration and constriction. It is one of the inflammatory bowel disease and it is characterized by transmural non-caseating granulomatous inflammation. Dear audience, it is one of the inflammatory bowel disease. The cause of disease is not known, so it is idiopathic. This inflammatory bowel disease is chronic, it is not acute. There is ulceration in the mucosa of the affected part of the small intestine and there is constriction in the affected part. And if we do histopathology, we will see transmural inflammation. Mucosa, submucosa, muscle coat, serous coat, all are involved by non-caseating granulomatous inflammation. There is granuloma but no caseation. So the inflammation is non-caseating granulomatous inflammation. This is Crohn's disease. Now come to age of occurrence of Crohn's disease. Again, it is one of the inflammatory bowel disease. Age of occurrence. It is common at second decade of life. It is common at second decade of life. Sex, male, female, both are affected, but it is more common in female. More common in female. More common in female. Now come to site of Crohn's disease. This inflammatory bowel disease, that is this Crohn's disease, may occur at any segment of the GI tract from mouth to anus. May occur at any segment of gastrointestinal tract, that is from mouth to anus. From mouth to anus, it may occur at any segment of gastrointestinal tract, but it commonly occurs in terminal ileum. Commonly occurs in terminal ileum. As it commonly occurs in terminal ileum, it is called terminal ileitis. As it is common in terminal ileum, it is called terminal ileitis. Called terminal ileitis. Suppose this is the terminal ileum and this is the colon and this is the cecum. This is the appendix. This is the terminal ileum. Dear audience, Crohn's disease sharply involves this segment of intestine. As it sharply involves this segment of intestine, it is also known as regional enteritis. Crohn's disease sharply involves the segment of intestine. So it is also called regional enteritis. So Crohn's disease is one of the inflammatory bowel disease. It is also known as terminal ileitis. As it sharply involves the segment of intestine, it is also called regional enteritis. Dear audience, now come to etiopathogenesis of Crohn's disease. Etiopathogenesis of Crohn's disease. The etiology of Crohn's disease is not clearly known. Etiology is not clearly known. It is suggested that infection by virus, infection by bacteria, and immunological reactions are associated with the pathogenesis of Crohn's disease. It is suggested that infection like virus such as rotavirus, such as Epstein-Barr virus, EBV, and some bacteria and immunological reactions. Immunological reactions are associated with etiopathogenesis of Crohn's disease. Again, the etiology of Crohn's disease is not clearly known, but it is suggested that infection either by virus like rotavirus, Epstein-Barr virus, by some bacteria, and immunological reactions are associated with the etiopathogenesis of Crohn's disease. So infection and immunological reactions are associated with etiopathogenesis. Etiopathogenesis of Crohn's disease. Dear audience, now come to morphology of Crohn's disease. Before that, again I recapitulate. It may occur at any part of the GI tract starting from mouth to anus, but it commonly occurs in the terminal ileum. Now come to morphology of Crohn's disease. Dear audience, I have told you it is idiopathic disease, it is chronic disease, there is ulceration in mucosa, there is constriction of the affected part, and there is transmural inflammation of non-cageating granulomatous inflammation. Gross examination reveals skip lesion. Gross examination reveals skip lesion. That is, there is lesional part in the intestine is followed by non-lesional part. Lesional part is followed by non-lesional part. Dear audience, if this is the intestine, this is the lesional part, again there is non-lesional part, again there is lesional part, again there is lesional part, followed by non-lesional part. This is lesional part, this is non-lesional part, again this is lesional part. This is known as skip lesion. The lesion is not continuous. Rather, one part is affected, then unaffected part, again there is affected part, and then unaffected part. This is known as skip lesion. This is not a continuous lesion. Gross examination reveals skip lesion, also reveals lead pipe or rubber hose appearance. The affected part looks like lead pipe, or the affected part looks like rubber hose. The affected part is hard and inflexible. The affected part of intestine is hard and inflexible. As the affected part of intestine is hard and inflexible, it looks like lead pipe or looks like rubber hose. Looks like lead pipe or looks like rubber hose. So one is stipulation and another is lead pipe appearance or rubber hose appearance. Another characteristics on gross examination is string sign. String sign. Dear audience, I have told you stipulation, affected part and unaffected part. In the affected part, the lumen of the intestine become very narrow. And if we do barium follow through X-ray, the barium is seen as thin stream in the narrow lumen. This is known as string sign. The lumen of affected segment of intestine becomes very narrow. Barium mill X-ray shows thin stream of barium in the narrow lumen like string. This is string sign. Again, the lumen of the affected segment of the intestine became very narrow, and barium mill X-ray reveals thin stream of barium in the narrow lumen, and it looks like string. This is string sign. Dear audience, if barium passes through it, suppose the red one is the barium, although barium is white, here the red one is the barium, although barium is white. Dear audience, in the unaffected part, the barium is not looking string, but in the affected part, due to narrow lumen, the barium looks like string. Looks like string. This is string sign. Another characteristics of Crohn's disease on gross examination, mucosal ulceration. Mucosal ulceration. So, on gross examination, the findings are stipulation, lead pipe or rubber hose appearance. Third one is string sign, and fourth one is mucosal ulceration. Now come to histopathology of Crohn's disease. Histopathology reveals non-cageating granulomatous inflammation in mucosa, in submucosa, in muscle coat, in serous coat. So the inflammation is transmural. So the inflammation is transmural. That is, all the layers, all the course of the intestine is affected by non-causating granulomatous inflammation. Dear audience, we know granuloma is the microscopic nodular collection of epithelioid cell. We'll get in all course of the intestine nodular collection of epithelioid cell, and you know epithelioid cell is one of the chronic inflammatory cell, and it is known as modified macrophage. But there is no caseation necrosis. You know, caseation necrosis is found in tuberculosis, and if there is intestinal tuberculosis, we will get their granulomatous inflammation, and we will get their giant cells, Langerhans type of giant cell, we will get their caseation necrosis. This disease is also in the intestine, but it is not tuberculosis. We will not get here any caseation necrosis, we will not get here any Langerhans type of giant cell, only will get epithelioid cell as nodular collection. So it is non-causating granulomatous inflammation in all layers, that is transmural inflammation. This is the histopathology of Crohn's disease. Dear audience, now come to consequence of Crohn's disease. Consequence of Crohn's disease is malabsorption. Malabsorption is the consequence of Crohn's disease. Dear audience, you know, as in Crohn's disease, there is ulceration in the mucosa, so there is reduction of absorptive surface of the mucosa. As there is reduction of absorptive surface, there will be malabsorption. Due to malabsorption, there will be malabsorption of fat, protein, carbohydrate, vitamin, water, minerals, etc. As there is malabsorption in Crohn's disease, patient may suffer from protein losing enteropathy, due to ulcerations in the mucosa. There will be no well absorption of protein, and protein will lose in the stool. Due to mucosal ulceration, there will be no well absorption of protein, and this is protein losing enteropathy. Megaloblastic anemia. Dear audience, you know vitamin B12 is absorbed in the small intestine in presence of intrinsic factor of Cassel, and there is receptor in the mucus of the small intestine. As there is ulceration in the mucus of the small intestine, vitamin B12 absorption will be hampered. So patient may suffer from megaloblastic anemia due to deficiency of vitamin B12. As there is malabsorption of fat, so there is excess fecal excretion of fat. So patient may suffer from steatorrhea. So these are the different consequences of Crohn's disease. Dear audience, today I have told you what is Crohn's disease. It is an idiopathic chronic ulcerative constrictive inflammatory bowel disease where there is transmural non-causating granulomatous inflammation. Cause is not known. It usually occurs in second decade of life. Female are affected more than male. It is thought that infection, either viral infection or bacterial infection, and immunological reactions associated with the etiopathogenesis of Crohn's disease. It may occur any part of the GI tract, but commonly occurs in the terminal ileum, so it is called terminal ileitis. Due to sharp involvement of the disease in this segment, it is also known as regional enteritis. On gross examination, there is skip lesion, that is, lesional part is followed by non-lesional part. The lesional part become hard and inflexible, and it looks like lead pipe or rubber hose. There is a string sign. In the affected part, the lumen of the intestine becomes very narrow, and barium meal X-ray reveals thin stream of barium in the narrow lumen of the affected part, and it looks like a string, the string sign. There is ulceration in the mucus, there is mucosal ulceration, and histopathology reveals transmural non-caseating granulomatous inflammation. There are some consequences. Due to malabsorption, patient may suffer from protein-losing enteropathy, patient may suffer from megaloblastic anemia, patient may suffer from steatorrhea. Dear audience, today up to this, thanks all.